Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. This is a show where we talk about heart health and interventions. Even young adults these days are suffering from sudden cardiac arrest due to a sedentary and stressful lifestyle. Without immediate recognition and CPR delivery, the chance of survival decreases significantly as each minute without life-saving interventions passes. It has been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests take place at home. CPR knowledge will equip you with the skill and confidence needed to transform yourself from the role of a bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. And today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We have Professor Dr. Rabin Chakraborty, a Senior Vice Chairman, Cardiology Services, Medica Group of Hospitals, Kolkata, Dr. Sushant Mishra, Chief Interventional Cardiologist, Mediterranean Heart Center, Gurugram, and Dr. Smit Shrivastava, Professor in HOD, Cardiology, Advanced Cardiac Institute, Pandit Jawaharlal Nehru Memorial College. Thank you so much, doctors, for sparing the time and joining us on this program. And Dr. Chakraborty, I'd like to start with you. Heart disease describes a range of conditions that affect the heart. So what are the types of heart disease? And if you could tell us what is the most common heart disease?
Thank you, Gargi. Good afternoon to everyone, my colleagues, Smit and Sushant. As we all know, that heart is the main pumping organ of human body. So it has got 4 chambers, 2 receiving chambers and 2 pumping chambers, and the 2 great vessels which pumps the artery from right heart to the lung and left heart to the body. This heart has got heart valves to monitor, to maintain the unidirectional blood flow from receiving chambers to pumping chamber and from the pumping chamber to the main artery. So there are 4 valves. Then you got heart muscles. Then you got a membrane to cover the heart. And then you got the electrical circuit which controls the heart rhythm. And finally, the important component is to maintain the blood flow inside the heart called coronary arteries. So when you talk about the heart disease, Gargi, it is for us to understand that heart disease could be the disease of the heart valves. There are 4 valves: mitral valve, aortic valve, pulmonary valve, and tricuspid valve. Out of these 4 valves, mitral valve and aortic valves are commonly involved. Then you got heart muscle, primary muscle disease, which is popularly known as cardiomyopathy. There are various types of cardiomyopathy, like heart is big, called dilated cardiomyopathy, heart is thick, called hypertrophic cardiomyopathy, with obstruction, without obstruction. Then there could be infiltration of the heart by some extraneous, some inflammatory substance called infiltrative cardiomyopathy. And then there could be restriction of the heart muscle called restrictive cardiomyopathy. Then you got a membrane of the heart called pericardial disease, and then the electrical circuit of the heart called heart rhythm disorder, which could be slow heart rhythm, for which patient may require pacemaker, or it could be fast heart rhythm called tachyarrhythmia or tachycardia, for which there is a different types of presentation, different types of treatment. And then the very important component of heart disease is coronary artery disease. Coronary arteries which are supplying the heart by blood, and that takes the nutrition to heart itself. And once there are some blockages of the coronary arteries, that is known as coronary artery disease. That eventually can cause heart attack, which has got a different mechanism altogether. I'm sure we can discuss as we talk.
Right. Well, that's a whole big list of heart diseases. And Dr. Shrivastava, if you could tell us, as we discuss, coronary artery disease is the most common heart disease. So what are its causes and risk factors?
Yeah. Dr. Rabin Chakraborty probably, covered whole of cardiology here. My part would be to concentrate on coronary artery disease. Coronary artery disease, as we understand, it is like a porridge or a atheroma or a blockage which is built up. It starts very early. It starts from when we are in mother's womb. That is, it starts in the fetus, and gradually this fatty thing is fed upon in the next 30, 40, 50 years. and it gradually grows in size and it starts blocking the arteries. So this is the cause for coronary artery disease. Sometimes, to add on to it, sometimes it ruptures and it forms an acute blood clot, sudden blood clot, and this sudden blood clot can obstruct that artery suddenly, all of a sudden, very acutely, and cause a total blockage of supply to the part of the heart, and that part of the heart gets damaged or it starts non-functioning. And this is where what we call it as a heart attack in the common language. This can be gradual because the build-up can be gradual. It can be fed over 40-50 years of time, and gradually it can give rise to slowly developing blockages, or it can be sudden, as I told you, once the this porridge-like thing, it ruptures and it attracts blood clots and it causes sudden blockage. The risk factors are same wherever we have something to add to this fatty deposition. So it can be diabetes, it can be a high cholesterol where the bad cholesterol part is high, or it can be where the good cholesterol is lower, or you have something like chronic kidney disease, which can add to this dyslipidemia type of thing, which can cause increased cholesterol deposition, or blood pressure, which can actually injure the arteries and have more such fatty things getting deposited, high intake of alcohol, mental stress. So list is very long. Even sleep is an important part where your heart as an engine needs to take adequate rest, and maybe you are not sleeping 6 or 7 hours at a stretch, or even if you are sleeping, you are snoring. So all these factors can become a risk for your coronary artery disease or heart disease, as we commonly call them, and that can result in blockages, gradual or acute, and finally heart attacks.
All right, Dr. Mishra, if you can now tell us which age groups have the highest prevalence of coronary artery atherosclerosis, and can younger people also get coronary artery disease?
A very good afternoon. Traditionally, coronary artery disease is believed to be a disease of a relatively older population. In fact, according to the largest prevalence study done so far, the mean age of presentation of CAD in West is supposed to be 63 years. Whereas for Southeast Asians or Indians, it is 53 years. So we Southeast Asians are predisposed to developing coronary artery disease at an average 10 years younger age compared to the rest of the world. In fact, even the prevalence of young CAD, that is occurring below 45 years, this prevalence is higher in Indian population than the rest of the world. Discussing about the second part of your question, which is even more important, and yes, coronary artery disease can occur in even younger people as well. Lately, there has been a huge surge in patients with heart attack occurring at very young age. Patients come to us at their early 30s, late 20s with massive heart attack. In fact, the latest data also show that around 1/4 of all heart attack in India is now occurring below 40 years of age. So the cause of this transition is still being explored, but to our current knowledge, most probably it's due to the recent change in our lifestyle, and more than that, more smoking in the young population.
All right. Dr. Chakraborty, many heart attack patients die before they reach a hospital. So the sooner a person can get to the emergency room, the better chance of survival. Also, prompt medical treatment reduces the amount of heart damage. So can a person help himself during a heart attack, and how much time should the treatment begin?
See, the answer is very simple, Gargi. That if some person suspects that it could be a heart attack, and then immediately they should come to the hospital. There is no way patients should stay at home. There is no data, scientific data to support that staying at home improves the life and reduces the mortality. Patient should be in the hospital, and immediately an ambulance should be called in so that the ambulance can take the patient to the hospital. And there are many ambulances nowadays, even in India. They have got good backup, good facilities with good trained medical personnel. They also actually can commence the treatment of heart attack right at doorstep of the patient inside the ambulance. That particular care is actually started in the hospital. That is we call the ambulance care of STEMI patients. So that has to be commenced. There is no way patient ever should think that this can be managed at home. This is a life-saving treatment, has to be done in the hospital, and in fact, the good quality ambulance with good trained medical personnel with good facilities should come to the doorstep of the patient and take the patient to the hospital. On the way to the hospital, the patient can be treated inside the ambulance with drugs to dissolve the clot, and there are various other ways of treatment facilities. Even if there is a cardiac arrest, the resuscitation CPR can be done inside the ambulance.
All right, Dr. Shrivastava, what is the role of coronary angiography in the diagnosis and treatment of coronary artery atherosclerosis, and when is it needed to perform this test?
Yeah, Gargi, let me tell you, it is never a first investigation of choice for even for a cardiologist also. So we rely more on taking a proper history from the patient and doing some non-invasive tests. Non-invasive in the sense, coronary angiography is the invasive test where you have an exposure for X-ray, and then a certain dye is put into your heart vessels and they are visualized. So there are strict indications where it should be done, and all the cardiologists follow that. So the indications are when you suspect a heart attack or you suspect that this chest pain of a patient is because of a blockage in the artery. Coronary angiography basically helps us to visualize those arteries and how much the blockage is, where the blockage is. It also helps us to plan the treatment subsequently, how we'll tackle this blockage, how we can relieve this blockage and help our patient relieve of that pain. Why it is not first choice when it is so much informative? Because one reason is radiation, because it needs an X-ray to be done. Then is the dye or the contrast that is put in. That also can sometimes cause allergic reactions. So we have very strict indications where coronary angiography would be done. But there is a lot of information which is gained from coronary angiography, and through you, probably I would like to spread this information to patients that if your cardiologist is suggesting a angiography, he has a valid reason for it. And with the information that he'll gain from that coronary angiography, ultimately he'll be able to help you win over coronary artery disease in the long run.
All right, well, we'll slip into a short break now, but don't go anywhere. We have many more questions to ask our panel of doctors. Stay with us. Welcome back. You're watching Health and Wellness. We're talking about heart health and also interventions. Dr. Mishra, if you could tell us who is the right candidate for an angioplasty and who needs a bypass surgery? Could a bypass surgery be a better option?
Well, decision of choosing between coronary angioplasty versus a bypass surgery or CABG, it depends mainly on two factors. The first one being the urgency of the treatment needed. So if the patient presents in a very unstable situation, if he presents with an acute myocardial infarction, where every minute of delay matters. So in such sort of situation, angioplasty can be performed much more quickly, and it is the treatment of choice. Whereas if the patient presents in a relatively stable situation, he presents in what is known as a stable ischemic heart disease. So for such patients, our second factor comes into play in deciding the modality. So the second factor is the lesion complexity. So the lesion complexity is detected by doing coronary angiogram, which Dr. Shrivastava already talked about. So if it is a very complex lesion, it will be having a lot of bends, a lot of calcium, or it is multiple in number. So in such sort of situation, performing an angioplasty can become technically very difficult. So this is the situation where a bypass surgery or a CABG may be a suitable option. Then again, there is a situation where both the procedures can be performed with equal ease. So in such situation, what nowadays is followed is known as a heart team approach. So a team is made between the treating cardiologist, a cardiovascular surgeon, and the patient. And they sit together, they discuss the pros and cons of both the procedures, and they try to arrive to a conclusion which is best suited for the patient.
All right, so trust the doctors and what they say or advise. Dr. Chakraborty, what are the signs and symptoms that a patient should be aware of post angioplasty, and what to do in a case of an emergency?
Sure, I think this is a good question. The answer to this question is very simple. What happens that this patient had some symptoms before the patient underwent angioplasty. It could be chest pain, it could be something like shortness of breath on exertion, or it could be some funny feeling of the upper abdomen, something like gas symptom, or sometimes in ladies, you can have a pain in between the shoulder blade. So after the angioplasty, if the same symptoms come back, then you want us to think about it, whether or not it is related to the previous angioplasty. I have to say very clearly that the symptoms of coronary artery disease could be different types of symptoms, like pain on the left arm, pain on the chest, pain on the face, particularly at the jaw. Then it can be pain in the shoulder blade, pain in the upper part of the tummy. So there are varieties of pain. But for a given patient, the symptoms will be always the same. One has to remember that after the angioplasty, patients are on multiple medications like statins and other drugs. Some of the medication, particularly statin, they can actually cause sometimes something like a muscle pain. And again, you have to remember that after a heart attack or after an angioplasty, some of the patients are mentally a bit anxious. They think any kind of pain, any kind of shortness of breath could be related to the previous angioplasty. That is not true. So whatever symptoms that the patient had before angioplasty, if the same symptom come back, may not be with the same severity, but to a lighter severity, but the character or the nature of the pain is exactly the same, that is a warning sign that whether or not that is related to the previous angioplasty. It is important for all the clinicians, the doctors, and also the patient relatives to understand that largely after a good angioplasty, as it is being done by many of my colleagues right across this nation, very good quality angioplasty, very good quality stents, and the results are actually phenomenally improved. It is at par with any international centers of this world. So the outcome has improved significantly. So the patients actually, they remain well for years together. But some of them, they may come back. But if they come back with same symptom that they have before the angioplasty, that should ring the bell. Not all those pains, not all those shortness of breath, not all those kind of heaviness of the abdomen. That has to be very clear. And the medication has to be continued. No medication should be discontinued without doctor's advice.
All right. Dr. Shrivastava, let's talk about CPR now. And does CPR apply in both conditions like cardiac arrest as well as heart attack?
Gargi, probably I'll label this as the most important question in the discussion, because this is a common misconception that everyone has, that cardiac arrest and heart attacks are the same thing. So to explain it very simply, Professor Rabin has said that a heart has two functions. It's like a pump which pumps out the blood. So it has two mechanisms where it itself has to use something as a fuel, and it has an electrical system. So electrical system, when it crashes or it stops working, the heart or the pump comes to a standstill, and this is what we medically call it as a cardiac arrest. So it is heart which has gone at a standstill. It is not pumping, it is not having any electrical activity, it is just lying there kind of a dead. But heart attack is when a part of it, the fuel, there is something wrong with the fuel pipes and it is not able to work efficiently. A part of it is not able to work efficiently. Though this may later on, translate into, exfoliate into a total standstill, then it would be a cardiac arrest. But prior to that, it becomes a heart attack. So they are two different things. And CPR particularly is useful in a cardiac arrest patient, not in a heart attack patient. Heart attack patient usually have their blood pressures, their pumping functions maintained, their electrical functions well maintained, and they give us time to transport them to a proper healthcare facility and treat them. Whereas cardiac arrest patients, they do not give us time. So here the bystander must become a doctor, and with spreading knowledge, most of us bystanders do now are being trained and they're becoming expert in CPR. Early CPR can save a life because CPR does not give us time. The survival rate in 100 patients of cardiac arrest even with CPR would be something less than 7 or 9%. Whereas with a heart attack, it would be over 60-70% who could survive and reach a health facility in 1 hour. So CPR would work well if the patient has a cardiac arrest, and if I can press it, even a thumb version, that means striking hard on the patient's chest once he has collapsed, can even save life in the initial few seconds or few minutes of that collapse. So don't shy away from that. whenever you have any help, you can ask the other person to call an ambulance. Meanwhile, you can start the CPR. And the CPR would have compression, airway and circulation, which is the standard format. And this really can save that life and can make a person survive.
All right. Dr. Mishra, what are the current guidelines then for CPR in India? If you could explain that to us.
Science-based CPR guidelines are developed by American Heart Association. It is followed globally. In India too, we follow the same guidelines. So this guideline has two commonly known versions. The first one is supposed to be for a general public or a bystander. It is very simple. It's known as hands-only CPR or compression-only CPR. And the second one is for healthcare professionals. So it has both chest compressions as well as mouth-to-mouth breathing in its components. So the steps of CPR is also very simple. First step is to recognize who needs a CPR. And the second step is the exact process of delivering CPR. So if somebody collapses right in front of you or is lying unconscious, unresponsive, and is either not breathing or is gasping for breath. So this is the patient who needs immediate CPR. If you know how to check, you can gather 10 seconds. So once you have identified the person who needs CPR, the second important step is to call for help or send for help, which is very important. Because one person cannot go on doing CPR forever. So now we start with the steps of CPR. So CPR is very simple. All you need to do is to locate the center of chest and start pushing with your hand, as rightly said by Dr. Shrivastava. All you need to do is to push centimeters or 2 inches, and how fast. So you are supposed to push at a rate of around 100 to 120 times per minute. So it is very simple. Even a 6th standard student with very minimum training can do it very efficiently.
All right. Well, thank you so much, doctors, for joining us on this program and increasing awareness about heart health. Thank you all for watching at home. With that, we'll slip into a short break. More news on the other side. Stay with us.